This is my week 4 entry on the vegetarian diet, the USDA diet, the American Heart Association recommendations, and what to eat. I'm just going to talk through each of these, and hopefully I will have answered all the questions along the way. So the vegetarian diet, the DGAC 2010 says that there may be some association between the reduced risk of cardiovascular disease, but there's very limited evidence showing anything, any effects on cancer, mortality rates, and weight loss. More likely, it's associated to lifestyle changes like exercise, hormone replacement therapy, not smoking, or something as simple as eating more nuts. There's also some significant safety concerns with vegetarian diets, and that includes not getting enough of certain amino acids that are found more so in animal proteins versus vegetable proteins, and simply not getting enough protein in general, as well as not getting enough zinc, iron, and B12 and calcium. Vegetable proteins tend to be harder to digest, and some vegetarians consume a lot more dairy products and soy products, which can lead to an increased risk in cancer. Your approximate carb content from most vegetarian diets is somewhere between 55 and 56%. So go ahead and eat those meats, except not all meats are created equal. Red meats and processed meats tend to have a lot more saturated fats, iron, sodium, and nitrates, which are not always good for you. The USDA presents their information as a cup and a cup and a plate. The plate having half fruits and vegetables, slightly more vegetables, and the other side having half grains and proteins with slightly more proteins, and a cup of milk to represent the dairy. The two main things that they stress are maintaining a calorie balance to reach and sustain a healthy weight, and focusing in on consuming nutrient-dense foods and beverages. All of this means limiting things like solid fats. They go after solid fats because it makes up 19% of the American diet, and it's also not very nutrient rich and full of saturated fats. So for the average American, that means you're going to want to limit cheese, pizza, and those grain-based desserts. Also, reducing added sugars, again, found in a lot of sodas and those energy drinks that everyone loves, and those grain-based desserts. Limiting those refined grains, lots of white bread. Also limiting your sodium intake to 23 milligrams for most average adults, 2,300 milligrams for your average adults, 1,500 milligrams if you're hypertensive or over the age of 51. The American Heart Association, it's more of a lifestyle prescription rather than a diet plan. And again, they stress balancing how much you eat with how active you are, and they suggest getting 30 minutes of exercise a day, most days of the week, 60 minutes if you're trying to lose weight or you're a kid. Eating more fruits, vegetables, whole grains, and high fiber foods. Eating oily fish a couple times a week. Limiting your processed and red meats. Choosing leaner cuts when you do choose to eat them. Again, limiting those sodas, juices, and energy drinks. Limiting your sodium intake. Moderate to low levels of alcohol. I've heard a lot of this throughout the rest of this course. And eating out what you would eat at home is also very important. If you are looking for a good diet to follow, the American Heart Association, the recommendation or the DASH diet would fall into these guidelines, and that's 4 to 6 servings of fruits and vegetables, which is about half a cup of cut fruit or vegetable and a cup of leafy green vegetables, and 6 to 8 servings of grains, and again, a slice of bread or about half a cup of your cooked rice, pasta, or cereal. As for macronutrient intake on energy, there's not really much to say unless the intake of macronutrients affects the total energy intake. So, and then the American Heart Association cutoff for LDL is less than 100, HDL is 40 for women and 50 for men. Tag levels is less than 150, and your blood pressure should be under 120 over 80. So So you want to reduce your risk of cardiovascular disease. What are some foods you can't eat? Things like nuts, fatty fish, legumes, fruits, and vegetables are all clinically shown to reduce that risk. Also, polyphenols are your friend. Where can you find these guys? Green tea has EGCG in it. Black tea has thorabigin in it and thorflavin. Red wine has resveratrol in it, and dark chocolate has epicatechin. My something new is green tea consumption affects cognitive dysfunction in the elderly, a pilot study done by Kazaki and others. Now, there have been a number of experiments done in vitro and in animal models that have shown that there is some possible neuroplastic effects of green tea and its components. Also, some epidemiology studies have been done and shown some possible relations between green tea consumption and cognitive function, but this is all very limited, and none of this has been shown clinically. So this is a pilot study to see if there is some of these relationships. They studied 12 patients, 10 women and 2 men, all over the age of 65. 8 of them had vascular dementia, 3 had Alzheimer's, and 1 had dementia with Lewy bodies. With the assistance of the assisted living center that all of these men and women were living in, they had relatively the same diets, and the assisted living center recorded what they ate, more importantly, how much tea they drank. They did not ask them to stop drinking tea. They simply recorded how much they drank on their own. They did, however, ask them to stop taking any supplements that had any possible antioxidant effects 7 days prior to the intervention and throughout the entire intervention period. They also had them take the mini mental state exam in Japanese both before and after the intervention, and the blood pressure, HDL levels, LDL levels, and TAG levels were also recorded before and after the intervention. The intervention was 3 months, and they took 2 grams of green tea powder per day with meals. And what they were able to show was that the baseline scores for short-term memory were improved at a significant level. The post hoc analysis of vascular dementia was also improved, particularly the short-term memory. The triglyceride levels were lowered, however, blood pressure, HDL levels, and LDL levels showed no change. Now, the biggest problem with this study is it's not blind. Everybody knew what was going on, and there was no placebo control. So there is a possibility of the placebo effect, considering all of the patients were told that green tea may have improved their cognitive functions. Also, this is a very small study, 12 people, not very big at all, and heavy on the women, 10 out of 2 men. So a larger study is needed. And of course, you're going to need some sort of placebo control. But this is a pilot study, and pilot studies are great to show some sort of baseline. So it's not a bad study at all, and I think it's got a lot of good information. So go ahead, pour yourself that glass of green tea. You may remember where you left your keys. And I'm sure that the zombies would appreciate the boost in brain power.